Welcome, Dr. Lauren Thornton. She is a pediatric anesthesiologist at Cardinal Glennon Children's Hospital at St. Louis University. She is also a vice president of MS Hardaway Health Systems, a telemedicine company. For those of us who may not know you very well, can you please give me a brief summary about yourself?
I am currently enjoying my practice in St. Louis with a great, amazing group at Cardinal Glennon Hospital. I couldn't be happier.
When you first completed your anesthesia training, did you know what career path you were going to take?
I actually didn't know which subspecialty of anesthesia I was going to take. I was interested in cardiac, adult cardiac, and peds, and those were the two that I felt were more promising. But of course, just having that experience with the peds arena solidified that I wanted to do peds anesthesia, and even more so. I'm currently being grandfathered into doing pediatric cardiac cases. So I'm really excited to have that experience and start that pathway in my career.
That's wonderful. It's nice to see you enjoying pediatric anesthesiology. I myself am a pediatric anesthesiologist as well. And there's a lot of interesting cases and a lot of opportunities in pediatric anesthesia. I wanted to ask you a little bit about your leadership at the MS Hardaway Health Systems. Can you please tell us a little bit about your role in that organization and how that opportunity came up?
Actually, it was a colleague of mine from residency from Albert Einstein in New York that was a former resident. And she came up with an idea of telemedicine in the perioperative kind of arena of medicine for anesthesia. And there hasn't really been that role of providing telemedicine and anesthesia as far as, especially for patients who are in rural areas or reservations and that don't have access to care and have to take multiple visits to the cities and contracted facilities just to do their follow-ups. And so this would help in providing that access to a physician and getting them ready for surgery and making sure that we have not only an adult anesthesiologist, but a pediatric anesthesiologist, that's my role, to kind of facilitate that interaction, that connection. So it limits the amount of times they have to come in, but obviously get them ready and avoid cancellations, obviously, the day of surgery.
Mm-hmm, mm-hmm, mm-hmm. That's great. I'm sure that it's a big help to the patients to have more accessibility to anesthesia, peri-op visits in preparation for surgery. How did these leadership roles come about?
Well, I had some of the best mentors coming on to my training, and prior to med school, I had Sean Delosi, a Native American primary care physician. In med school, I had one of my deans, David Taylor, in residency, obviously Drs. Straker, Joseph, and Aquino. They always were the best role models for me. They probably carried me through some of my toughest times, and it was always to make sure that I represented and practiced with excellence and they pushed me to take these leadership roles. So it was in many ways them opening the doors for me with the great faith that I would be paying it forward.
That's very nice that you had these mentors to help guide you. That actually segues into some other questions I had about mentorship. Mentorship is important for career advancement, as has helped you. And how did you find your mentors?
I seek them. Prior to going into medical school, I did a lot of volunteering and partnership with Native Americans and American Association of Indian Physicians, who had amazing youth programs for anyone interested in sciences and obviously going into the promising careers as a physician in medicine. So I seek that, and I found those opportunities. And whenever I saw a woman that I was very, very impressed with and wanted mentorship, I asked for it. So I took the actual steps to ask for it. I don't always let it fall into my lap. So those were always the ways of getting the mentorships that I needed.
Mm-hmm. Mm-hmm. Thank you for that. I think it's important for people to recognize that sometimes you just have to ask, right? And not to shy away from asking. Um, what is the best advice you have received from a mentor?
The best advice I have received from a mentor: never give up. I know it sounds so cliche, but even during the times of residency, training, life experiences, personal things that may come up, you have to really compartmentalize and be ready to deal with it once that one little area is finished. And if you are unable to address any emotional, spiritual, mental, and physical health problems, then you're never going to get through anything. And all of those are important. So address them as much as you can, and always know that certain areas can be addressed later on, not everything all at the same time.
Mm-hmm. Mm-hmm. That's good advice. Thank you. Networking is also an important aspect of career development. What role has networking played in your career?
Networking, unfortunately, can sometimes be an intimidating and tumultuous endeavor, of course. However, the approach you take is really key, and remembering to always be genuine without any expectation of self-gain. And I know that sounds kind of confusing, but if you approach certain avenues in networking and people, you have to make sure that you're not anything that's not authentic. And I can remember being at the legislative conferences while as a resident, speaking to the ASA presidents and executive members, and even several state representatives while advocating for anesthesiologists. And it was very empowering to take action and build a great relationship with my colleagues. And so just the opportunity of doing any and everything in every kind of networking arena, and every kind of opportunity from anesthesiologists from everywhere, you have to take it. And you never know what you can actually gain from it, or what opportunity or some connection you can make for someone else that may be needing that too. So not always self-gain, just, maybe for your colleagues and your other future people coming up.
Thank you. As a successful leader in anesthesia, how have you found it difficult to balance your academic and clinical career with your personal life? And what strategies have you used to help you manage that?
It's very difficult. I'm past that realm of newly married or newlyweds, and I wanted to focus on, enjoying the relationship I have with my husband, growing our relationship, starting a family, being grounded somewhere. My advice is for personal: you must know your goals when you're training, where you want to be, where you rank your career, whether it's your passion as number one or your family is number one, whichever falls into that category out of the four that we've always kind of been told of grading. That's what you need to focus on. And whoever is with you that doesn't understand those numerical priorities, then it probably need to set them aside and focus on that. And anyone who cares about you and in your personal life, keep them close, and who appreciates everything about what your endeavors are. So balancing personal is important and should be number one, again, because if you can't take care of yourself, you can't take care of patients. But focusing on those numerical things too, you'll always be grounded and focused on making sure that you separate the two, but you know which one is priority.
Yeah. Yeah. It's important to prioritize your goals. But it's hard to sometimes manage both because some things are timely.
Yes, things are very timely. We have a clock, and I keep hearing that often.
Yeah, everything is very timely, so it's can be sometimes a little difficult to manage those things. If you had one piece of advice to give to a young attending starting out in the field of anesthesia, what would it be?
Definitely, it is okay to change your path, practice, and goals in your career if you truly are unhappy. We still have the mentality fresh out of training to please colleagues and your superiors. Remember, you have only your patients, your family, and yourself to answer to, so always do them justice.
Thank you. That's awesome advice. Thank you so much. Thank you for joining me, and I appreciate your time and all your wonderful advice and your life experience. Thanks for sharing.
Thank you so much, Allison. I appreciate this. It's amazing that you're doing.
Thank you.